All right, so hi, my name is Patrick Breitnauer, and I have a topic that is sure to stir the pot a little bit: circumcision. The American Academy of Pediatrics has claimed that the benefits of the procedure outweigh its risks, but a group of physicians from outside the United States looked at that claim and were kind of like, nah, like they see cultural bias in it. And I will be referring to these physicians later on as Frisch et al. Today I will be arguing that the negatives of circumcision outweigh its positives because the benefits are a little exaggerated and it just doesn't really seem justified in comparison to the risks of surgical complications and the harm associated with the procedure. All right, so first, when I say the benefits are exaggerated, well, what are the claimed benefits? So, the claimed benefits include risk reduction for HIV, urinary tract infections, and penile cancer. But the last one is a little rare. A risk estimated around 1 in 100,000, so it's not really, like, I'm not going to lose sleep over that. But HIV and urinary tract infections, yeah, we can talk about those. So a few studies conducted in Africa found a risk reduction of 60% for HIV, but that's 60% relative to what? Now, I do want to bring up that America has both a higher HIV infection rate and a higher circumcision rate than Europe, but we are looking at a risk of 4 in 1,000 compared to a risk of 5 in 1,000. So while there could be risk compensation involved, it's a little too small to really declare anything for sure. That being said, we will be using the HIV prevalence for Europe because their circumcision is rare enough that we can kind of ignore it. So what does the 60% relative risk reduction mean? Well, that would mean an absolute risk reduction of just 24 in 10,000, or in other words, you would have to perform about 417 circumcisions to prevent 1 case of HIV. Now, for urinary tract infections, things look a little better. The American Academy of Pediatrics has estimated the number needed to treat as about 100. So that's pretty good. But does it compare, how does that compare with the risks of surgical complications? Some of these will include minor conditions like natal stenosis and skin breaches, but there are also some serious complications involved here, like infection, hemorrhage, partial or total penile amputation, and even death. Frisch et al. Estimated the overall complication risk at about 2%. It's a little hard to find hard numbers on this, so they had to make an estimate. So going back to the number needed to treat for urinary tract infections of about 100, that would mean you would have 2 complications for each urinary tract infection prevented, which, I mean, sometimes that might be fine, but UTIs are a pretty minor condition. They're easily diagnosed and easily treated, so like it doesn't hold a lot of weight. Now, what may hold a little more weight is HIV. So with our number needed to treat that we calculated earlier, it would be 8 complications for each case of HIV prevented. And while we can weigh HIV more heavily, we could also consider using more low-risk interventions like condoms, which we should be using anyway. And like eventually, like when you're already using those, the absolute effect of circumcision is going to go down. And never mind the fact that babies are not sexually active, so they're not at any risk for HIV. And finally, there is harm associated with the procedure. And this is not just a minor consequence. Like the American Academy of Pediatrics, the same guys who said the benefits outweigh the risks, said that preverbal pain can cause severe changes which last well into childhood. And anesthesia is often not used during the procedure, and even when it is, it's obviously not going to help with post-operative pain. So some degree of pain is inevitable, and even if you get rid of all the pain, going back to some of the complications, penile amputation, I don't think I need to explain how that's harm. I have argued that the negatives of male circumcision do outweigh the positives, mainly because the benefits have been a little exaggerated, and there is a risk of surgical complications, and there is harm associated with the procedure. And I know that this is not a very easy conversation to have. We don't really want to talk about it, but I do think it's important to talk about this. Thank you.
All right, well, you identified the topic. You kind of sounded like you were going to start with a joke, but then you pulled back on it and decided not to. The proposition is stated pretty clearly. The secondary points, you outline them. The phrasing on them is not always clearly declarative sentences, but I do know the points that you're talking about here as you go through the speech. In the excuse me, in the body of the speech, you don't really signal those points as clearly as you could, although if you're listening carefully, you can pick them out. And I think that I'm listening pretty carefully, so I heard them. I think you could help your audience a little bit by adding maybe a numerical signpost or just giving us some transition language that would indicate those points. Like I said, I was listening for those points because of the preview, but not everybody is going to be as careful at that, and I think you would help them out a little bit more. You kind of explained the risk what the benefits are. I like the idea that you are doing a comparison and you are going to discuss what the benefits are, and you've got kind of a complicated explanation of the statistics and what they mean about how many of any kind of problem is going to be avoided by the circumcisions. And let's assume that I'm willing to accept that the numbers that you presented and the analysis that you have there at face value. That sounds pretty good. What I thought was a little bit odd was that you didn't have a concomitant sense of those risk factors for anything other than the UTIs on the second point. Everything else was a little bit vague, and I think that that's really and you say, well, these things are almost universal, but how significant they are, I don't want to do, well, I guess I do want to diminish pain, I'm not exactly sure how the pain is affecting kids at that particular age when it's usually done. Now, if you're getting this done as an adult, I can imagine that there is a substantial issue that's going on there, and the procedure's probably done a little bit differently, but that's not what you're talking about for the most part. So, you mentioned that there are all these kinds of complications, but you don't tell us what the risk factor of those complications are so that we can compare them to the other. The only one that you have a little bit of discussion of is, like I said, the UTI. And then there's kind of a hint with HIV, and then you're saying, well, we get 8 complications for each case of HIV that we avoid. And I'm going, well, if the complication was that they had a sore penis for a night, and 8 kids had a sore penis for the night versus 1 HIV case that was avoided, that seems like a reasonable trade-off to me. So you're making the argument on the one side pretty effectively. I just didn't think you made the argument on the other side quite as effectively. I like the explanations that you had there, but we need to move on to the next speaker, so I'm going to cut this short.